We've all been using social media to stay connected with our family and friends during this pandemic, and perhaps are using it more than before as a form of entertainment to combat the stay-at-home blues. But one platform in particular has exploded during coronavirus: Tik Tock. The app was downloaded 315 million times from January through March, beating every other app in a single quarter. But celebrities and teens aren't the only ones going viral. Even our medical heroes need a moment of levity. That is Dr. Jason Campbell. He is a resident physician at Oregon Health and Science University and an essential worker in the world right now. When he's not making the rounds at the hospital, he's rallying the troops for a little cha-cha slide or a corona foot shake. And it's brought smiles to millions of viewers online. And joining us now is the TikTok doc himself, Jason Campbell from Portland, Oregon. Thank you so much for joining us on the program. Now, Jason, I want to start off by telling you that I am a fan. I've been watching your videos since they've essentially went viral, and it's all positive vibes when it comes to your feed. How'd you get into making these TikTok videos?
Absolutely. So the TikTok videos started with me desiring to reach the youth and a desire to reach the African American youth, and actually started before COVID-19, if you can imagine. And I thought that if I can meet them where they're at, and they can one day meet me at medicine or at desiring to become a lawyer or businessman or woman or anything of that nature. And so I decided to get my bosses involved and said, hey, we take our job seriously, but we never have to take ourselves too seriously. And let's try this dance. And that was for charity. And then another dance was to excite the youth. And then healthcare workers came, and it was to incite all of us.
So there's a bigger picture when it comes to these TikTok videos that you're making, and I don't think everyone really understands the aim with these videos here, because you've received backlash for making these videos, saying that takes away credibility from the medical world. What would you say to those people?
Sure. Thank you for bringing that point up. These videos were never to detract from the severity or to lessen the severity of COVID-19 or of any disease that our patients are undergoing. These were for a moment of levity from such a tough situation, and a chance for us to come together, really, because what people forget is that whether there's COVID-19 or not, we're still working 10 to 12 hours a day. Our nurses are still working 10 to 12 hours a day, all of the medical personnel, and it's a very demanding job. And so for us to be able to smile and laugh, and in the video you see right here, have doctors that maybe are really bad at dancing still smile and laugh, that was the focus, and it's always been the aim.
Now, Jason, this pandemic is still very surreal for me, and we're trying to get used to this new normal that we have here. Just tell us what it's been like being a frontliner and working through this pandemic.
Sure. Well, in the United States, it differs from city to city, state to state. Luckily in Oregon, people have stayed home, they've stayed safe, they've been practicing good social distancing and self-isolation as necessary, and that has helped keep our numbers lower. But, for my colleagues, friends, coworkers that are in New York or other states that have been hit hard, it's a scary time. Mm-hmm. It's definitely frightening, unprecedented, and we know that we will get through this, but it's taking time. It really is. All
right, Jason, now this is probably the most important question of all. What are you planning for your next video?
So one of my coworkers, Nurse Grace, she actually just got some matching shoes to the first ever video that you saw. So she has some patriotic shoes. I now have some. So get ready, July 4th or earlier. We're gonna do something pretty American and patriotic, and we're excited. And like I said, it's just all about having a moment of joy and fun, and whatever the next dance is, we're gonna hit it. So
all right.
Stay tuned.
All right, Jason, we'll keep an eye out for that. Thank you so much for joining us on the program.
Thank you for having me.